So good afternoon and welcome to the 10th webinar in our Integrative Practice Webinar Series here at the Academic Collaborative for Integrative Health. My name is Deb Hill and I'm on staff here with the Collaborative while I help to facilitate our working groups and our projects. Some housekeeping up front. All attendees are in listen-only mode. Please type your questions into the question box and we will get to as many as possible at the end of today's presentation. So some of you today might not be familiar with the Academic Collaborative for Integrative Health, or the Collaborative for short, so I wanted to just give you a little overview. We are a nonprofit organization working to build partnerships, educate, and collaborate all around patient and person-centered healthcare. Our core members are the 5 licensed integrative health and medicine professions that have a federally recognized accrediting agency. Our membership also includes organizations representing traditional world medicines and emerging professions that are engaged in self-regulation and are working towards future licensure. So together we represent approximately 400,000 licensed integrative health practitioners through our member organizations. And so more information, if you're interested, can be found on our website. So this webinar today is an outcome of the work done by our Integrative Practice Webinar team here. We have a project team that has been working really diligently to get these webinars put together. So I want to thank this interprofessional team of volunteers for all of their work. So as stated, our goal of this project is to increase understanding of integrative practice by hearing from those currently practicing in these environments. So you'll see some of the topics here, and many of these topics will be covered in today's webinar. And today's webinar is the 10th in our series. Should you be interested at taking a look at any of the others, you can find those on our website underneath our Working Groups tab. So without further ado, I want to welcome Integrative Practice Webinar Project Team Leader, Dr. Mitchell Zeifman, to introduce our guests and to get us started with today's presentation.
Thank you so much, Deb. Thanks everybody for attending today. It's great to see all the names that are here. Some I recognize, some I do not. Thank you for joining us today. I'm really excited to present to you our 2 speakers today from Beaumont Health Integrative Medicine, Karen Armstrong and Hallie Armstrong, not related, but with the same last names. And they're here to talk to us today and present about the Integrative Medicine program at Beaumont Health. I'll introduce both of them first. So Hallie Armstrong, Naturopathic Doctor, is the lead ND with Beaumont Integrative Medicine. Prior to joining Beaumont Health in 2008, she worked in multidisciplinary settings at integrative medicine clinics in Metro Detroit. She believes it is vital to treat the whole person and is dedicated to providing patients with a team-based approach to wellness. Currently, Dr. Armstrong serves as co-facilitator of the Faculty Scholars Program in Integrative Healthcare, an educational program that trains traditional allopathic physicians and allied healthcare employees in the methods and concepts of integrative health. She's an adjunct instructor at the Oakland University William Beaumont School of Medicine, teaching medical students about holistic modalities. She is also the site leader for the Integrative Medicine and Residency program at Beaumont Health, partnering with the University of Arizona. Dr. Armstrong earned her bachelor's degree from Michigan State University and graduated as a naturopathic doctor from the Canadian College of Naturopathic Medicine in Toronto. In her practice, she has worked with diverse populations to treat physical and mental health concerns. She focuses her practice on women's health, fatigue, and digestive issues. She regularly contributes articles to local newspapers, peer-reviewed journal articles, and lectures on health topics such as menopause, detoxification, and urology. Dr. Armstrong has sat as president for Michigan's Southeast chapter of AIHM, the Interprofessional Integrative Medicine Organization, and is the recipient of Oakland County's prestigious Elite 40 Under 40 Award. Dr. Armstrong also enjoys teaching at Beaumont's Oncology Massage Program and at Irene's Myomassology Institute in Southfield, Michigan. In her spare time, Dr. Armstrong enjoys taking care of her free-range chickens, fainting goats, 3 beehives with her husband and 2 children, Amelia, age 10, and Oliver, age 9. So welcome, Hallie. And next, Karen Armstrong. is the current manager of integrative medicine at Beaumont Health, and since 2007 has been serving as the manager of clinical massage and program director of Beaumont's oncology and hospital massage class in Michigan. Ms. Armstrong oversees operations of 3 hospital-based integrative medicine clinics. Modalities offered in these clinics include acupuncture, clinical massage, functional medicine, naturopathic medicine, yoga, Reiki, integrative dietetics, and several educational programs. Ms. Armstrong has initiated several research projects and co-authored multiple published manuscripts. She is a former Society for Oncology Massage board member, former chairperson of Michigan's Board of Massage Therapy, a past president of the Federation of State Massage Therapy Boards, and serves on many educational advisory boards. Ms. Armstrong is an adjunct instructor at the Oakland University William Beaumont School of Medicine, teaching both medical students and residents about integrative medicine. Ms. Armstrong promotes the benefits of integrative medicine to hospital and medical administration, faculty, the community, students, and patients. She frequently presents at community and hospital events. So welcome, Karen, as well. Welcome to you both. And now I will leave it to you to take it away with your presentation.
Great, thank you. Thank you for having us. This is Hallie here. And Deb, you're going to be controlling the slides, correct?
Correct. So just let me know when you need the next one. Yep.
Perfect. So we're going to talk about today the Advancing Hospital-Based Integrative Medicine through Treatment and Education. So that's what the title of our slide is. You can advance to the next one. And then our overall agenda, we're going to talk a little bit about the history of our health system, and then why education is offered through Beaumont Health and the Integrative Medicine Department, and then what education is offered through our department. You can go forward. And then just a little bit of a background about our health system. It really is an evidence-based conservative healthcare system. And so overall, it's in Southeast Michigan, and there's 8 hospitals with 167 outpatient locations. And as a background, overall, the reputation of the healthcare system is really quite conservative. It is very evidence-based, and it's one of the largest hospital systems in Southeast Michigan. As you can see with these numbers, we've had a couple of mergers in the past, making us quite large. You can, yeah. And then I'll pass it over to Karen. Yep.
Hi, everyone. This is Karen. I'm going to talk more about the operational side of the department. Integrative medicine at Beaumont was developed in 2004, and we opened the doors to patients in 2005. The chief of oncology services at the time knew to have a truly comprehensive cancer program, Beaumont needed more than great oncologists and great nurses. In addition to creating integrative medicine, he also launched a genetics program and a lymphedema clinic. Integrative medicine at Beaumont started by offering clinical massage, guided imagery, and Reiki for oncology patients. But it truly didn't take long for other departments like neurology and cardiology and orthopedics to call and ask if their patients could use integrative medicine service as well. The next request was from caregivers. We received calls like, "You helped my sister so much. Can I come in and use your services as well?" Then we started receiving calls from Beaumont staff. "Hey, I'm hearing great things from my patient. I would like to book appointments. Can I book these appointments as well?" Well, based on all of these demands from the different population, we changed our policy and became available to the public. So our patients don't have to have a Beaumont doctor. They don't have to be a Beaumont patient. In fact, we often treat patients whose physicians work in other healthcare systems. In the early years, integrative medicine leadership spent a lot of time meeting with Beaumont staff and offering education about integrative medicine. Whether it was rounding on the floors or meeting with physicians one-on-one, there were 3 points that we felt were most important for everyone to hear. The first was integrative medicine practitioners at Beaumont have the highest level of education in their field. Michigan is is overall an unlicensed state for most of integrative medicine modalities, but we would only hire practitioners who had the highest level in the modality they were offering. The second point is we look at research and we don't make false claims. The healthcare system is evidence-based, and so is our department. If there wasn't research, we clearly stated that. And the third point was integrative medicine supports the physician care. The focus was truly to integrate holistic approaches with the great traditional care they were receiving from Beaumont staff. With this approach, our volumes grew quickly, and the #1 referral became Beaumont staff, and specifically from physicians. In addition to our volume growing on the main campus, we, over the years, were able to open 3 additional clinics, and we added several different modalities. Next slide, please, Deb. So here's a slide of what integrative medicine at Beaumont looked like pre-pandemic. And I'll talk more shortly about how the pandemic has affected us. So we started with massage, Reiki, and guided imagery, but you can see all the other modalities we've offered through the years. Next slide. So in regards to our staffing model, all Beaumont integrative medicine staff are employees. We don't have any independent contractors on staff. We have full-time and part-time. Both of those groups are eligible for benefits. And we also offer, we also employ contingent staff. And that staff is non-benefited, but still employees. Of course, there's pros and cons to each employee group. Offering benefits is the greatest advantage for staff, but of course the costliest for the department. Now, as I mentioned, Michigan is unlicensed for most integrative medicine modality practitioners. Other than, of course, our MDs, massage therapists are currently the only other provider, and they've only been licensed since 2009. Of course, not having licensed practitioners in the hospital is a real concern, as there's no there's no education requirements or renewal requirements, there's no minimal standards, and there's no oversight for public protection. This is one reason that we keep our hiring requirements so high. Now, the staff at integrative medicine is part of the healthcare team, and our staff must complete the same competencies as the rest of the hospital staff. And these include things like electrical safety and compliance, HIPAA, just general compliance. But in addition to that, we also have specific competencies for each modality. So for example, an IM leader may present as a patient, and the practitioner has to complete an intake, offer a treatment, and complete charting. They're evaluated on the effectiveness of the treatment, communications, skills, and referring to other providers. We believe integrative medicine works best when we approach it as a multidisciplinary department. So one modality isn't better than the rest. Next slide. The integrative medicine business model is a little bit complicated, and I'm going to try and sort this out for you. So first of all, we have 2 physicians, 2 MDs on staff. We had 3 and we're lost 1, and we're in the process of hiring another one. One of our physicians accepts most major insurance, and the other, who's our medical director, accepts Medicare, Medicaid, and Beaumont Employee Health Plan. So our hospital is self-insured, and the BEHP is what I'm going to call it, the Beaumont Employee Health Plan, is what's offered to our employees. We also receive grateful patient donations, but we don't have a major donor, and we don't have an endowment supporting the operations of integrative medicine. So the department operated as a cash model from when we opened until 2010. Oncology services helped support the department financially for the first couple of years, and then after that, we were expected to self-support. And we were doing quite well at that point. In 2009, we partnered with Occupational Health and the BEHP plan in a small pilot. There were several staff members who had filed workers' comp claims, who had soft tissue injuries, and had failed to improve enough to return to work. This group of staff, who we'll now call patients, were given 8 acupuncture appointments and 8 massage appointments, 1 each per week. After the 8 weeks of treatment, many of these patients' conditions improved enough for them to go back to work. So the plan was thrilled with the outcome of these patients, and due to that success, the following year, we expanded our services with the plan and offered a larger pilot, which again, we had great success. In 2010, there were 35,000 people covered by BEHP. So employees, spouses, partners, and dependents. Acupuncture and massage became a covered benefit for musculoskeletal conditions and oncology patients. And the employees or the patients at that point only paid a $20 service fee per visit. And as you can imagine, our volume skyrocketed. The next year, naturopathic appointments were covered, acupuncture and massage visits were extended, and the diagnoses were expanded. And each year, the benefit grew. In 2010, our first full year partnering with the plan, in conjunction with the new benefit, coverage for chiropractic services was reduced from 38 visits to 12 visits. This single change in coverage, covering IM services while reducing chiropractic services, resulted in a savings for the plan of $1 million. So this all sounds great, but it came with challenges. Some of our challenges were staffing. We literally couldn't hire staff quick enough to fill appointments. Then we ran out of space. We were utilizing every corner of the hospital we could to treat patients. Available appointments became a problem for the public. We have patients that wanted to use our services and they were having challenges getting in because so many staff were using our services. And the biggest challenge is we weren't generating new revenue for the hospital. Our volumes increased, but the revenue itself didn't. It was like one department paying another department. So unfortunately, due to financial challenges, the benefit was eliminated January 1st of 2020, and we returned to a cash model except for our 2 MDs. To help ease the transition, employee rates for acupuncture and massage are now offered. In pre-pandemic, we had a robust community acupuncture program, which offered lower costs for staff as well, but we haven't reinstated community acupuncture. So I could spend an hour talking about this program and how we partnered with the plan, but we obviously don't have time for that. But we did publish a manuscript, and on the slide, there's a link to that manuscript if you'd like to learn more about the plan. Next slide. So I wanted to talk about how COVID has impacted integrative medicine at Beaumont. March 16th, we closed all of our clinics, but MDs and NDs started treating with telemedicine appointments, and we kept 3 administrative people on staff, 1 front desk person, our practice manager, and I remained working. April 22nd, all of our staff, except for physicians and myself, were officially furloughed. I was moved down to a part-time position. And I worked strictly to support our 2 MDs at that time. And we operated this way through almost the end of June. June 22nd, we reopened 2 of our 3 clinics with acupuncture, massage, and naturopath appointments. Part-time, the front desk staff came back part-time, but still limited hours for quite a while. Our 3rd clinic was reopened the week of July 20th, but again, with limited hours. As of today, our 2 large clinics are open 5 days a week, and our smaller clinic is open 4 days a week. We have 2 front desk staff back full-time, but all of our practitioners are not back to the hours they were pre-COVID. So we still have several staff with limited hours. Now, we also have some staff that didn't want to return. Whether they don't want to work in the hospital, they've decided to retire, or they're going to remain in private practice. Next slide, please, Deb. So here's a comparison of the modalities in integrative medicine at year-end 2019 and year-end 2020. So the biggest changes are our physicians and our naturopaths are doing both telemed and face-to-face. We're no longer offering inpatient for Reiki appointments at this time, although I expect to reinstate that soon. And right now, yoga therapy and guided imagery are still suspended. If we go to the next slide, please. This will show more about our volume. So the year end 2019, we treated almost 23,000 patients. In year end 2020, we're at almost 7,000. And then you can see the difference in staff, 45 staff in 19, and we're down to 26. So just over half staff that we had previously. All right, Dr. Hallie?
Yeah, so thank you for that introduction about the department, Karen. And now we're going to move on to education. And we thought it was important to cover education overall in the department because it's a huge part of helping to change the face of healthcare. We like to educate people, obviously, to help to educate them about integrative medicine modalities in general, but then they also have some really wonderful back-end benefits from providing education to both Beaumont employees and people of the public. And two of those things that we really are, that we like to focus on is when we're offering education programs, and we're going to get into the specific educational programs that we offer, it ends up being kind of like a long training interview process. So for instance, for the massage school that Karen's going to talk about in a couple of minutes, it's a course, and during that entire course, while the massage therapists are going through it, we get to observe how they are interacting with patients, their abilities, and their motivation around the department itself. So it becomes a prolonged interview if they would be a good match into our department and in a hospital setting. It also opens up benefits for patients who are, like Karen was talking about, most of our services are cash-based pay, and so it can become very limiting for the public. People can't afford it or can't access our modalities. And so with student clinics, it offers the underserved population to have access to our modalities. During the student clinics, we'll offer free clinics or decreased rates, and so then patients who can't normally afford us can come in and use our modalities. So there's other benefits than just education. Next slide, please, Deb. Education also really creates a sense of community. And I know that we can all kind of identify with this, the lack of community that many of us have experienced with not only being in the integrative medicine health field. It can be a lonely profession, but also it really was emphasized during COVID. And so we know how important the community is, and so really by providing these educational services, it really places our department as a leader within the healthcare system. So we have pharmacists calling us all the time, or other medical doctors asking about different interactions. So it places us as an expert in the field, but it also, again, creates that sense of belonging for the people who have gone through the different programs, the educational programs like the Faculty Scholars Program that we'll talk about in a couple minutes. I often will hear the different students say, oh, I have finally found my people, or found my group of people that I can really communicate with. So that's a really important part. And then it also creates referrals, because people who hadn't heard about integrative medicine in general, once they start taking courses about it and they understand that we're very evidence-based and we want to play with the other healthcare team members as opposed to an alternative to the typical medical model, then we're also creating more referrals from practitioners within the healthcare system, and then people who are in the community as well. health. So it's multifaceted of the benefits that we receive from providing education. Next slide, please, Deb. These are an overview of, and we're going to go into detail of all of a lot of these programs in the future, but this is kind of an overview of the different programs that we offer within Beaumont Integrative Medicine. So we work with medical students, residents, faculty scholars program, culinary medicine, community-based, massage therapy, Reiki, and yoga therapy, but we'll go into a little bit more detail on the next upcoming slides. Next slide, please, Deb. So the medical students, this is an opportunity. We have a medical school associated with our healthcare system with Beaumont, and it's called OUWB, or Oakland University William Beaumont School of Medicine. And with that, the fourth-year med students have the opportunity to come in and observe our clinic if they have an interest in integrative medicine. We also have students from all over the country and Canada, well, all over, also Puerto Rico will come in from the program VSAS, or the Visiting Students Learning Opportunities. Students will have the opportunity, sometimes they will come for a day and observe, sometimes we have them for the entire month. But just like all of the employees within the integrative medicine department, all students have to go through the HR training. So everybody has to have their TB test, their flu shot, and electronic medical records training. And one feedback that we've had from students in the past is that they want to be more hands-on, but with our modalities, that's a little bit difficult. So it is an observational only rotation because we can't really have students inserting needles with, for acupuncture with just one day of training. So it is an observational only rotation. Next slide, please, Deb. We also interact a lot with the residents. We have collaborated with the University of Arizona for their Integrative Medicine and Residency program, or IMR for short. And that is a program that is really well done. It's a 200-hour online-based, module-based program that is offered for family medicine residents within Beaumont Health, and they will do it during their family medicine residency program. And so if they have an interest in integrative medicine, they can sign up for this IMR program, and they get access to the evidence-based module program online that they will do on their own time. But then we also offer, if they sign up for this specific program partnered with the University of Arizona, they will spend 2 months throughout their 3 years of residency with us in integrative medicine. It is required through the University of Arizona that we need at least 29 hours of on-site training in addition to the online modules. So residents will get that 29 hours through the observational time. We also have case studies, quarterly case studies that we all meet right now via Zoom and discuss different case topics. And the program covers botanical medicine, Chinese medicine. It covers nutraceuticals and a lot of nutrition, and it's very comprehensive. It's a wonderful program. That program also includes a yearly retreat that's usually hosted in Arizona, but in 2020 and 2021, because of COVID, it's been virtual. Next slide, please. I forgot to mention that we do have residents from other healthcare systems and residents that are not involved in the integrative medicine and residency program that also will contact us and follow us for a rotation, whatever their schedule permits. So this is the faculty, this slide talks about the faculty scholars program, and you've heard us mention it a couple times already. And this is a curriculum that's 10 months long, and it offers about anywhere from 60 to 70 continuing medical educational credits, hours of that. And it's a It's a program that meets one Friday a month, and usually all day from about 8 in the morning till 5 in the evening. And it
I think we might have lost you there.
Hey, I don't hear anything either.
Karen, are you still on? I see that Hallie's talking. Maybe she hit the mute button.
Yeah, I'm texting her really quickly. I'm sorry.
different modality.
Okay,
Pardon?
Hallie, we lost you for a few minutes. We couldn't hear you.
Oh, can you hear me now?
Perfect.
Okay, perfect. I don't know what you missed, but the main idea is it's multidisciplinary approach, and we are multidisciplinary cohorts. The scholars will all meet together and learn about different modalities such as acupuncture one day, or oncology, how integrative medicine will approach oncology or chronic pain or cardiovascular disease. We have expert speakers come in, and we also offer breakfast and lunch, and the food that is associated with that day is usually it has to do with that specific topic that we're learning about that day. So we'll have a heart healthy lunch, and so it really creates an environment of higher education learning and the opportunity to learn from one another. So it's a wonderful program there. So next slide, please, Deb. The next part of education that we're looking into is culinary medicine. Culinary medicine, for those of you who aren't familiar with it, is this evidence-based field that blends the art of food and cooking with the science of medicine. So it aims to help teach practitioners, so physicians or nurses, PAs, NPs, to teach them how to cook easy, simple, affordable meals. There was a study done that showed that the more physician was participating in self-care or eating healthier, the more likely they would be to tell that information to their patients. And so it really makes that jump from telling patients to go and eat more fish or more fruits and vegetables, whereas if the physician actually learns how to cook them and use healthy recipes in their own life, that they would hopefully say to their patients, oh, I tried this new salmon recipe and it's really great with an avocado and a salad, and let me give you the recipe really fast. And so that kind of dialogue, just that quick shift, really increased compliance for patients to increase their healthy habits themselves. It's really a really fun class as well. Physicians will get together and will actually cook together in a demonstration kitchen, and so it's a lot of fun, but we're also learning quite a bit. So, and the patient benefits. Next slide, please, Deb. And I'm going to hand it over to Karen.
All right, thanks, Dr. Hallie. So we teach two different oncology massage classes at Beaumont. One is our 100-hour oncology and hospital-based massage therapy, and then we also offer an introduction class that's only 24 hours, and that class is really the basics. What do you absolutely need to know to not harm a patient? We know a lot of massage therapists are not interested in coming to the hospital, but we also know oncology patients are going to the spa and going to all sorts of clinics, and we want to make sure that everyone is treated safely. The oncology massage class was the first class offered through Beaumont Integrative Medicine. When the department was created, there was still that crazy thought that massage could spread cancer. And the chief of oncology knew that wasn't correct, and he knew that there had to be contraindications. And with the correct training, he truly believed oncology massage could be safe and effective. So with his support, this class was created. The curriculum was developed with input from oncologists, nurses, pharmacy, epidemiology, pastoral care, social work, and a nurse who also taught at a local massage school. So it was a real collaborative program to make sure that we were looking at all aspects and making sure that At that point, oncology massage was fairly new, and that we were doing it the right way. This class, the 100-hour, teaches students how to treat safely in an outpatient clinic or in an outpatient setting, as well as inpatients. And then, because a lot of students don't want to come to the hospital, we created the introduction class and can take that to a specific spa or to another area and treat those patients. In addition to the oncology and hospital-based massage class, we also have offered several continuing education classes for massage therapists. And these have varied throughout the years. Sometimes a staff member will come to me and say, hey, Karen, I'm really interested in learning X. And I find an instructor and bring them to Beaumont and teach our staff, and then invite other massage therapists to learn either as well. So again, it's improving and raising the education level of the massage therapist at Beaumont. Next slide, please, Deb. The other classes I'd like to talk about is Reiki and yoga therapy. And both Dr. Hallie and I always get these deer in a headlight eyes when we say that we offer Reiki therapy classes in the hospital. We've been teaching Reiki level 1, 2, and 3 since 2006. And the key to this is our Reiki curriculum is really evidence-based. And I know we both keep saying that over and over again, but that has been the key. Our Reiki classes, the majority of the students are nurses. So we've been able to get their attention, and they not only take level 1, but a lot of the nurses are also taking level 2 and level 3. Many of the Reiki graduates join our Reiki volunteer program, and our volunteer program, treat patients in both our outpatient clinics as well as inpatient, in palliative care, in orthopedics, and in oncology. Yoga therapy, we offer level 1, 2, and 3 also. And this is a little bit of a unique program. Not only is it evidence-based, but we invite guest presenters. So we have a lot of Beaumont physicians present, and a lot of faculty from Beaumont's medical school that Dr. Hallie just discussed. These students supervise small group yoga therapy, of course, under supervision. And then level 3 is really focused on offering outpatient care, and we use our clinics. Next slide, please, Deb. So as Dr. Hallie mentioned, and I certainly don't want to repeat what she says, but one of the unique offerings through integrative medicine is our student clinics. With both oncology massage and yoga therapy, as I said, we can take the students anywhere into any patient room in the hospital and allow them to treat those patients under our care. And I know a lot of students say that's sometimes what brings them to Beaumont because of this unique opportunity. Next slide. Dr. Hallie, I think that's you.
Yeah, so the other thing that we're really involved in is community presentations. It's part of our mission is to help to support and change healthcare, and so we're always helping to educate the community. So wherever we can, we are doing presentations. We'll go to senior homes or libraries, or we often will let people know within their cancer support groups. We're at health fairs or Chamber of Commerce events, and this is really just a tip of the iceberg of where we are actually speaking. Part of when people get hired in our department, part of the hiring process is often discussed. Do you like to speak in public or do community presentations? And because it's such a big part of our overall department in educating both the community, and you've seen the different healthcare providers within our healthcare system and in other healthcare systems, that it's important that we all are teaching as much as possible. So that wraps up our presentation, and now we would love to take any questions that you have.
Thank you both so much for that amazing presentation. I know Mitchell and Beth have been monitoring some of the questions, so I will let Mitchell, if you have a couple there to start out with, that would be great.
I do. Yes, I want to echo that. Thanks, Hallie and Karen. That was excellent. Thank you for the information you presented us with. It was really interesting and brings up a whole lot of questions from me, but I'll start with one that we received. The question is, could you please explain why nurses who are trained in integrative medicine, especially modalities such as MBSR, Reiki, nutrition, aromatherapy, addiction and pain management, cannabis for pain management, Ayurveda, homeopathy, etc., are not included in hospital integrative medicine, but instead physicians and NDs are used almost exclusively when these modalities were actually championed by nurses historically. Can you answer that question?
Do you want me to take that, Hallie?
Sure.
So I don't think there's just one answer for that question. I think really it comes down to each hospital's business model. And I hate to say it and repeat myself, but a lot of our modalities are not covered by insurance. So there has to be this, revenue generated in order to cover expenses. I think that's one of the big challenges. Now at Beaumont, we do collaborate with nurses, and often we worked with labor and delivery nurses and created a 2-year program, and some of the nurses are doing holistic treatments bedside during labor. So I think that is one of the main reasons, but I think each hospital system is going to have to make their own decisions. Now, one other part is our physician, our medical director must supervise all modalities. And again, because we're generally not a licensed state, there has to be a physician on staff at Beaumont that our practitioners are delegates of.
Okay. Thank you very much. The next question I have was from one of our listeners that is a chiropractic student and wants to know if the integrative medicine program allows chiropractic students to preceptor. And I'm assuming that that would be your visiting student learning opportunity, the VSAP that you spoke of. Is that correct?
Correct. I don't know if you're asking me if it's correct. Do you want me to take that, Karen?
Sure.
Yes, please.
Okay, so yes, chiropractic students are definitely welcome to observe. And again, the main requirement is just making sure that you have all of the HR requirements, that the TB test and the flu shot and all of that is a prerequisite of coming to observe us. But yep, we can definitely accept chiropractic.
Terrific. The next question is, it looks like acupuncturists do have licensure in MI under the Department of Lara. Is this correct?
Yes, that's brand new. It actually they haven't been able to apply yet. They were registered and they're going to become licensed effective in 2021. It's just not available for application just yet, but will be this spring.
Great, thank you. Somebody is asking about the link that you gave Karen to post it again, which I believe we can do. We can post it in the chat, I think. Maybe Deb, if you can put that into the chat, we'll put that up.
I'll work on that, and also all of our slides at the end. We will post all these slides with the links and help with any questions that were unanswered to today moving forward. So all the slides will be posted on our website, within the next week here. That's
right, and previous integrative practice webinars are also available on the site too, if anybody's interested in that. The next question. So do you have a listing of resources that a practitioner can use to introduce physicians to the benefits of acupuncture and integrative medicine? There are a lot of scholarly articles, but are there some more viable than others?
We have a list. We are often doing the presentations to physicians. And so it's really targeted toward that specific audience of whomever we're speaking to. If you have a specific group of types of physicians that you're looking to present to, feel free to reach out to us, and then we can send you any kind of information specific. But I don't have a pre-done list of specific articles that I access overall. Do you have one of those, Karen?
No, I don't. My answer would have been the same, Hallie.
Yeah, but I'm happy to send those over to you if you want to contact us individually, and our contact information can be found on the presentation as well.
Thank you very much. Okay, next question is about the Reiki programs 1, 2, and 3 and how long they are.
Sure. Reiki 1 is just a 1-day class, and Reiki 2 is a 2-day class. Reiki 3 is also a 2-day class, but there's some home study between level 2 and level 3.
And similarly, a question about the yoga 1, 2, and 3, same question.
Yeah, those classes are a year each. So that's a much longer program, and someone can sign up for level 1, but not 2 and 3. So those are about a year each.
Okay.
And you have to be a yoga instructor to sign up for those already.
For level 2 and 3, you do.
Okay.
Yeah. And information on those 2 programs, where would that be available?
That's on our website. You can go to beaumonthealth.org and search Integrative Medicine. It's just that they're all suspended right now. We haven't been able to reestablish any of our classes since COVID, but working diligently to make that change this spring and summer, hopefully.
Okay, thank you. The next question is there any methodology that was followed to implement the program?
To implement it, that was, we created a business plan and worked closely with the Chief of Oncology Services. We worked with hospital administration, medical administration to create it. Is that the question that's being asked, Mitchell? I want to make sure I answer that correctly.
I am assuming so, but that's what I have.
Yeah. So I was really creating a business plan, and we're part of the hospital and our staff is part of the healthcare team, but we operate as an independent department and responsible for our budget, hiring. Of course, it's through Beaumont, but we operate as a complete separate department from anyone else. Now, we fall under oncology services because that's where we started, but we still have a separate operating budget.
And just to add to that, we have written a manuscript regarding naturopathic medicine in particular, but there is, there's a link to the manuscript, thank you. But there's also a manuscript to talk about how to introduce naturopathic medicine in particular into a healthcare setting, and we can provide you with that link as well. That's published through PubMed. You can find it through PubMed.
Wonderful, thank you. And that leads to another question, which would be, do you have recommendations of books or materials about holistic management?
I don't. I don't know, Dr. Hallie, if you do, but we work closely with our leadership team, whether it's finance or for operations and marketing department. So it's, I say that we're an independent department, but we're lucky to have all these great resources in the hospital.
Terrific, thank you. Well, I mean, you've provided some good resources that you've worked on already, and there are a fair number of resources for holistic management available as well, but those are a lot of different books that have been published so far. The next question would be, what has the feedback been from MD students who have observed the integrative care model at Beaumont? Do they receive any sort of primer before observing?
We usually do about a 15-minute to a half-hour orientation before they start rotating with us, and we will give them a little bit. If they are a resident that is already going through the integrative medicine and residency program, they have that background. But if it's a med student or a resident that's not in the integrative medicine and residency program, we'll meet with them and talk a little bit about each modality, give them a little bit of a background. We send them prior to them coming into the clinic, we send them an overview of each modality and a little bit of resources of where they can find more information. And then the feedback is usually wonderful, because what's happening is they're seeing, if it's residents, they're seeing patients and the patients are asking about, supplements or things that they have found on the internet or have seen in, Dr. Oz, and the residents haven't been trained in that. So they really are curious about the different modalities and the different ways that we're treating patients. So it's a great experience to watch.
It sounds like it. Thank you.
Mm-hmm.
Okay, the next question. So do you have any thoughts about how you will get back to your pre-COVID staffing? What will it take?
I start to laugh to myself because I think it's a lot of hard work. I think we're on the right path, and watching our numbers, our volumes, I find it really interesting that our volumes for employee massage and acupuncture is growing quicker than our patient volume. And I find that interesting because I think it's, I don't have any research, I'm stating that clearly, but just from observation and talking to staff, I think it's because it's pandemic fatigue, and it's what the healthcare workers are seeing, and they're aware of integrative medicine services, so they're reaching out. So our plan is continue to market, continue to talk to everybody that will stop and listen to us for 5 minutes, and reassure them that we know how to use PPE safely in the hospital, and it is available. That's a concern. We've heard many patients say to us, well, I want to come and get a massage, but I know Beaumont's going to do it right. So we're trying to spread that word as much as possible.
Terrific. Next question is, do you know of any programs currently working with schools of Oriental medicine, acupuncture, and herbal medicine?
I do not, Dr. Hallie.
The question of any schools working with it, is that the question?
I think I'm assuming that means any other integrative medicine programs.
I do not.
Okay, that's a simple enough answer.
Wish I did.
Okay, so I think we've ended off with audience questions, and thanks for the information from Marilyn Gerber, who has added some stuff on nursing that I won't get into. It wasn't a question, but definitely some comments there that are interesting. So I was wondering, as we get to closing off, if both of you were to look back on the program's successes and challenges, is there anything that you could think of that you would have done or had done differently or should have been done differently with it?
Oh, that's a loaded question, Mitchell.
Exactly.
Oh, I'm sorry. So maybe your top thing that you would have done a little bit differently.
Yeah, our biggest challenge, of course, is finances, because we're expected to support ourselves and to support our budget. So, I would love if a major donor walked through our door today. So I think, that's part of it is focusing on philanthropic funds and looking at other ways to generate revenue is so important. I think one of the challenges we had is when we were working with the Beaumont Employee Health Plan and the insurance plan, is that simply grew faster than we had anticipated. And I don't think we were prepared for how quickly it grew. And that, of course, added some additional challenges.
Yeah, fast growth seems to be a big challenge for any program that's successful.
Mm-hmm.
Great, thank you. And another question that I have is, what do you see as, you know, the focus of your future development of this program?
Well, interesting, because we just did our strategic plan last week, so we're still working out the details, but it's really going back to what we did in the beginning and our core modalities. We don't feel it's necessary to add a bunch of new modalities at this point, and we want to focus on what we have and make it the strongest program we can. And I think we may have been there anyways, but the pandemic has forced us to look at the department and maybe the finances and the operations a little bit differently. So not adding a lot of new programs, but working on the ones that we have. I think that's going to be our focus for the next couple of years.
Well, that sounds like a good focus, absolutely. I don't see any other questions coming through, and we're nearing the end of the hour. So I will thank you both for the time and the efforts that you put into this presentation. It was incredibly informative and interesting, I'm sure to everyone and to me as well. So thank you so much. It's really been a pleasure having you as guests in the Integrative Practice webinars. I hope everybody listening has enjoyed that and found this beneficial. We're going to be continuing to bring webinars on integrative practices and how different integrative practices come to deliver their medicines across North America and worldwide as well. And we're interested in anybody that might be interested in bringing that information to us as also. So you can always get in touch if you have an integrative practice that you want to talk about and present a webinar on. And I want to also echo a thanks to the team that's worked on this project, who Deb introduced at the beginning of this program. Thanks very much to everybody and the work that you've put into this.
And thank you for having us.
Yep, and thank you both for presenting today. It was a wonderful presentation. So I know if anybody has any additional questions, I know we had you know, your contact information up. Also feel free to contact me as well, and we will send email blast to everybody once the recording is available and the slides are up on our website. So thank you again for all of your time today, and thank you all for attending.
Thank you.
Thank you. Bye-bye, everyone.
Take care and stay safe, everybody.
Bye-bye.